I'm 24 years old and I am sexually active.
I'm 18 years old. I don't have a boyfriend, but I do sometimes see someone I like.
I'm 14 years old. I am not sexually active.
I'm 22 years old and I am sexually active.
I think it's the physician's responsibility to make sure that we take a complete and comprehensive sexual history on all patients. But for teenagers, I do it with every visit. I say, is everything okay? Do we have any needs in regards to sexual health?
Sexual health is about having a positive and respectful and responsible approach to sexuality and relationships. You can't tell if your partner has an STD just by looking at them. Most STDs don't have any symptoms, so a good way to have a safe and healthy sexual relationship is to go with your partner and get tested before you have sex.
I had had a sexual experience with my first partner and I was like, I need to tell the doctor, and I know they're gonna ask if it was with a female or male, and I need to be honest. It was scary. My doctor was very cool. She calmed me down. She's like, it's all right. I see that kind of thing all the time.
So when was the last time you had sex?
It was about a month ago.
Okay. Did you have sex with males, females, or both?
Males.
Okay. And it's important at the onset of the relationship with the patient to tell them that I know that things may be embarrassing. I'm going to meet you where you are, as you are, and appreciate that.
When I went to a general checkup for my doctor, it was the first time I asked about sex. So I was nervous about asking. And the reason I asked was because I was very curious.
So Madeline, today what we're going to do is do a sexual history on you, okay? And the purpose of me doing the sexual
She asked if I was sexually active, if I was dating a boy or a girl. And I said, I am not currently sexually active. I like boys and girls, but I do not have a boyfriend or a girlfriend.
I teach physicians all the time about being as non-judgmental as possible, especially when you're talking about sex.
When I spoke to my doctor, I had a negative experience. I had a new partner and we used protection, but I developed like a rash and I just felt like I should go get it checked out. And she looked at it and she said, if it looks like a duck and it quacks like a duck, then it's probably a duck. And I just felt like that was really inappropriate. Like I left the appointment crying because I was so upset. And finally they called me back to get my actual results and they were negative.
If your doctor is judgmental when you bring it up, then you really need to think about if that is the provider for you. When I go into the room, I say everything that we're going to talk about in this room once the parent or guardian steps out is confidential, unless I think that you're going to harm yourself or others. I encourage all physicians to have policies that are posted in their office to talk about what are the confidentiality issues.
Confidentiality is really important because I know that if I were to be having sex and my mom was informed, I would be like, I'm never gonna talk to you ever again. So there has to be trust.
I know sometimes people feel that oral sex is much safer, but you still can contract STDs that way as well.
STDs from
Yes.
oral sex?
Yes.
My doctor helped me understand that even if you're just having oral sex, you're still putting yourself at risk for HIV and for other STIs. And that was something that I didn't know before.
If anyone finds it hard to talk about sexual health with their parents, then they should definitely talk to a doctor.
Now when I talk to my doctor about sexual health, I really don't have a problem with it because I developed a good relationship with my doctor.
As a young person, you have the right to talk to your healthcare provider about your sexual health. You don't have to be embarrassed. Your provider can help you figure out for which STDs you need to be tested and also help you figure out how to protect yourself against getting STDs.
You need to talk to a person who is experienced in health. It's like, duh.